This is going to be a job that you're going to be at for between 3 and 5 years. Okay, it's got to be a place that you see yourself growing in, that you enjoy working at. When going into a residency interview, you're obviously being interviewed as an applicant, but I think it's really important for medical students to be interviewing the program as well. I'm Dr. Greg with Medical Muscle, and I'm going to share with you guys really simple but very powerful things you can do as an applicant to get the most information, obviously stand out as an applicant, but also how to ask the right questions for yourself. Before you get into the interview, it's really important to collect as much information as possible. Obviously, you're going to go on the residency program website. You're going to look at all that information. But there's much more information that can be really important. What I would always look for, YouTube videos. You can sometimes get a sense from these videos of what the culture is like. Obviously, it's superficial, but it can be very helpful to get an idea of what kind of applicants they're looking for. What I found the most helpful as an applicant to a program are the residency meet and greets. In those talks, I got to figure out more what the program was about, the pros, the cons, than the website itself or YouTube videos. Going to those meet and greets can give you a lot of insight onto what kind of questions you should ask in your interview. So after you've collected all this information from the website, from these residency meetings, the next thing is to come up with really important questions. You might have your own, but these are questions I feel like are very important because at this point now, this is going to be a job that you're going to be at for between 3 and 5 years. Okay, it's got to be a place that you see yourself growing in, that you enjoy working at. Residency's hard. I understand that, but you want it to be a good environment for you, for your own growth. So what are some questions you should be asking? How many 24-hour shifts do you have as a resident? As a student, it may not be one of the top questions that you have, but I'm going to tell you that how many you have can really affect your quality of life as a resident. How many calls do you have? Okay, how many calls a month? Do you have them once a month? That's pretty doable. 2 a month can be tough. 3, are you on call every other weekend? That can be tough. Every weekend? That can be tough. So it's important to know that call schedule. How many hours are you working every day? Like, what is your day like? Is there a patient cap? Is there a max of how many patients you can see a day? That's very important. Do the residents hang out outside of work? Do they actually get along? If it's a friendly, inviting environment for collaboration, people will hang out outside of work. If residents don't hang out outside of work, it might not be that they're not cohesive as a team, but they might be all working so much that they don't have time to go out and have fun. What kind of fun things are there to do in the area? It's a great question because it also gives them the opportunity to tell you things that they enjoy in the area. It makes you more memorable when the person gets to talk about themselves a little bit. What is the didactic schedule like? Okay, how many hours do you have in didactics? If you want more research, do they offer that? How many vacation days do you get? What are the perks? Are there any added perks of working for this residency program? Do you get access to a gym? Do you get like childcare? How much autonomy do you get as a resident? Are you having a lot of oversight, which is a good thing when you're first year? Or do you have a lot of freedom, which is also a good thing too, because you also learn a lot when you're on your own. And I think one of the most important for my case was what population am I working at, okay? Because if I go into a fellowship, I want to have the training in my residency that's going to show me if I want to pursue this kind of fellowship or not. I got lucky at my psychiatry residency. We have an inpatient child unit. I'm getting a lot of exposure to working with kids in the psych field. Not all programs had that. Actually, most didn't have an inpatient unit like that. So that was something that was really important for me. So you have all these questions that you want to ask them. Now, how do you prepare for the questions that they ask you? It's really simple. You can go online and look at all the different types of interview questions that you could likely be asked. Usually there's hundreds. With every one of those questions, you should be able to answer it with a quick, short story that answers the question and shows something about yourself. Nice thing is, although there might be 100 different types of interview questions that you could be asked, generally, you're gonna use the same story for maybe 10 different scenarios. So I'll give you an example. When did you have conflict with someone in the hospital? You can create a story for that that fits very well with when was there an ethical dilemma that you faced, okay? It's really the same type of question. Ethical dilemma or conflict can have the same story. Obviously, you're gonna have to create your own stories, but you should have some concise, really powerful stories that show you as a person, that are not egotistical, that are not generic. They're you, they're real stories that you can share during your interview. Because again, the interview process is very short and they have to really make some judgments off of just a small snippet of who you are. All right, guys, I hope that was helpful and I wish you guys the best of luck in this interview process.